Thank you very much, Professor Dua. It is my great pleasure to be with you this afternoon, morning, certain locations, to share what we are doing together on SOSCHI projects. And I'm very happy because these projects have been done with a collaboration with Ghana University and UK Office for National Statistics in UK. So for today, we will be discussing about some statistics around climate and the health. So we know that currently climate is affecting health. And so thank you again and welcome from this section. We'll be talking about officers, climate and health statistics, and mainly we are going to talk about assessing malaria incidence attributable to extreme temperature in Ghana. So as I said earlier, these projects have been done with a collaboration within Professor Dua, Professor Mauli, and I myself from Ghana and Rwanda. So quickly, what we are going to discuss this evening will be around the conceptual importance of climate and health statistics, basically on malaria topic. We'll be screening up some empirical evidence and knowing what have been done so far on this topic. And then later on, we will talk about the causal pathway, how climate is affecting malaria cases. And then designing, like talking about the research gap and the objective of our presentation. And then we'll discuss clearly about the indicator that we propose for measuring the climate's impact on malaria cases. We'll be seeing how those indicators align with the global set indicators. And then we will discuss about slightly the data requirements to have like those indicators computed. And then we will discuss a little bit about the methodological approach and finalize with the result that you obtain using the Ghana case study. So globally, what can we say about climate and health? So we know that when we are talking about health, we are talking about human well-being. And when we are talking about malaria, we are also referring to vector-borne diseases. And vector-borne disease currently represents like one of the global health challenges in the world. Itself represents about 17% of infectious diseases and cause more than 700,000 deaths annually. So among vector-borne diseases, malaria is one of the most, like the highest that affects women. We notice that around, for example, 263 million cases are reported like in 2023, with an incidence of 60 cases per 1,000 population at risk. Those are the statistics that we found from the World Health Organization. But what we notice that among those high number of malaria cases, sub-Saharan Africa country represent like the highest proportion of those malaria reports. About 94% are in was found in sub-Saharan Africa in 2023. Meaning that in our area, we are more than endemic malaria area. We need some solution. We need some. We need to take action so that we can reduce malaria cases. Specifically in Ghana, we notice that Ghana also is part of sub-Saharan Africa, and then it's also an endemic area, highly at risk of malaria, where the prevalence range from or between 3% to 31%. So all these statistics prove that when we are talking about malaria, we are in face of a global health challenges, public health problem. Add to those public health problems, currently we are having what we call climate risk. The climate risk is the change in temperature, change in precipitation of rainfall that later have like an impact on those diseases. From a recent report, IPCC reports, Intergovernmental Panel on Climate Change, we noticed that over the last decade, mortality due to water-related conditions have been increasing 15-fold. This is a big concern. We notice also that if we do not have any effective adaptation strategy to control those waterborne diseases, mainly for malaria, during the next 18 years, the malaria cases will increase. And this will mainly affect vulnerable populations such as children under 5, pregnant women, and elderly people. So this gives us like an idea to come up with some solution. But before coming up with some solution, we check the existing research, those who work on climate and health, some empirical evidence, basically in Ghana and in sub-Saharan Africa. What we notice that we have a number of studies that highlight the impact of climate change on health, mainly climate impact on malaria. Those research define clearly how, for example, increasing in temperature affects malaria cases and how changes in rainfall also affect malaria. For temperature, most of studies highlight that we have like an optimal range that are associated with high malaria risk. And those range are between 25 to 30 degrees. And then for the rainfall, we notice that when we have a rainfall within like less than 120 millimeter, then those rainfall are highly associated with heavy rainfall. However, other research also found that when we have like a temperature above a certain range, that temperature contribute to reduce malaria cases. Later on, we will see the mechanism by which those extreme temperature are contributing to reduce malaria cases. Other research also highlighted that the effect or the impact of climate change on malaria cases are not linear. They are non-linear relationship, meaning that if we have like climate exposure effects happening today, it might take some times before we will see diseases outbreak. For example, if we have rainfall today, it can take maybe 2 months or in terms of weeks, 4 weeks, 8 weeks before those impacts will, impacts will reach a human being. So based on those research again, we identify clearly that the climate impact on malaria cases also depend on the vector species. For example, if we are considering falciparum species, the climate impact, the temperature impact might be different when we are considering the Anopheles gambias. So those are the elements that we find from the empirical evidence. And the empirical evidence also, we identify clearly that there were like so many methodological approach that were used to have like to assess the interaction between climate and health. However, we have like those elements, but we need also to understand clearly how the pathway, how those extreme temperatures are really affecting malaria. So based on what we defined earlier, it is clear that when we have like a certain level of temperature, those temperature might create a good condition for mosquito development, meaning that temperature control mosquito development, biting frequency. So as I said, meaning that we have a certain level of temperature that are favorable for mosquito development. Generally, those range from 20 degree to 30 degree, depending on the climate zones, whether we are in arid zone, whether we are in humid zone, or whether we are in semi-arid zone. And then when we consider rainfall specifically, rainfall creates like some breeding site for mosquito development. And then when we have, for example, a certain amount above like the normal range that are favorable for mosquito development, those heavy rainfall can act as an actor that flush away mosquito breeding site, mosquito larvae, and then decreasing the mosquito beating frequency and so on. Meaning that we have extreme rainfall acting first, creating the breeding sites, but when we have a certain amount, that will be unfavorable for mosquito development. But when we have, for example, flooding in the first time will flush away some mosquito breeding sites, but later on will create another pulse for those mosquito development. So here we realize that the impact or the impact pathway are very complex. And then we need to identify clearly at which level extreme rainfall or extreme temperature are affecting malaria. The impact pathway are also like the impact might be high if we don't have any adaptation or mitigation policy in place. And those lead to, for example, some impacts, having like fever, anemia, or like globally increasing cases of malaria. And then those are like pregnant women may have like a complication in terms of giving birth and so on. So for our study currently, we are mainly focusing on those cases, those people that went to the hospital that were reported that was tested positive of having malaria cases. Based on what we discussed earlier, we identified clearly that studies apply like several methods, and then those methods are different. That complicate, for example, a comparison at like country level or sub-country level. So the main goal of our study here is to come in with a standardized framework, a standardized methodology that can be used in every country so that we can have a good statistic that might be comparable. The second problem that we or gap that we identify is that people discuss about climate impact, but we don't have a clear matrix to measure or to report those impacts. Like if we are talking about metrics, we are targeting, for example, relative risk, attributable rate, attributable number. So the target of this project also is to have like a standardized indicator to report those annual, to report annual basis those impacts. So that, for example, if we take a specific area at a specific year, we might know how much those climate factors are contributing to malaria cases. The other one also is that currently we do not have a generalized system where we might have like an integrated data, having like a climate data, health data, population data together to simplify policy evidence so that we can inform policies and like take action quickly to fight against malaria. This means that we need a platform where we can have an integrated system. So our projects aim to have like two main objectives. Developing, for example, the standard and unified statistical framework, and then for reporting like the annually the impact, and then having a platform where people can go input their data and download the statistics. So based on those goals, we come up with some indicator that we are developing. And those indicators from malaria cases, we have two. We have malaria incidence attributable to extreme temperature, and then we have malaria incidence attributable to extreme rainfall. So for being able to have those indicators, we are using four metrics. The relative risk that will inform us the area with high risk for a specific focus or intervention. We have the number of malaria cases attributable to extreme temperature. That one is the attributable number that will inform us about the excess number or excess cases that are attributable to the extreme temperature or extreme rainfall. We have the attributable fraction or the fraction of malaria cases attributable to extreme temperature. That one will inform us about the proportion of the excess cases among the observed cases in a specific location. And then finally, for comparability, we have the attributable rate, which help us to have like to integrate the population in, and then have a comparison within country, like within region, within like districts. So all these indicators help us to have a clear idea about how much those climate factors are contributing to malaria cases. Those indicators that we propose align with existing framework, mainly the one from the global set of climate change statistic and indicator. As we can observe here, within that framework, we have one of the indicators that are targeting incidence of cases of climate-related diseases. And then for that one, they propose to have like an incidence of climate-related vector-borne diseases. And what we are doing here is that we are specific to malaria cases, and then we are attributing it to a specific exposure, which is extreme precipitation or rainfall and extreme temperature. And then we have a specific statistic or metrics to measure those impacts. So for being able to use the proposed methodology or the proposed tool that we are developing, there is some requirements. First of all, we need like count data. The count data might be a monthly reported malaria cases at district level. So if you do have like that data set for a minimum period of 3 to 5 years, the model can work correctly. And then we need a key variable like malaria cases, the region, the dates of reports. We need also to have like temperature data, precipitation data, vegetation cover, relative humidity, runoff data, and population data. Within those variables, we have like a key variables. The key variable, for example, temperature, precipitation, and population. But other variable like vegetation, relative humidity, runoff water are considered as co-founders that might also have an impact on malaria cases. So we recommend to have those data, and those data are easily accessible from the National Health Management System, and then also the climate data can be from the National Meteorological Agency, or even we can use like the global or reanalyzed data from ERA 5. So for the modeling approaches that we are using, we have like identified that the impacts between climates and the malaria depend on the the location. And then also we identify clearly from the existing literature that we have like a delay effect, meaning that if the temperature event is happening today, the impact might be in some weeks later. So this gives us the idea of using to combine two methods. The first one is the spatial modeling, that is the Bayesian spatial model, and then that one helps us to have like to take in consideration all the spatial heterogeneity, the seasonality, and so on. And then we have also the distributed lag nonlinear model that help us to take in consideration the delay effect. And based on those combined model, we come up with quantifying the relative risk. And then based on the relative risk, we now calculate the attributable number and the attributable fraction. The model helps us also to disaggregate like the data by considering, for example, under 5, above 5, male, female, and so on. So all those elements will help us to have like a statistic for a specific group. If I want to have a statistic for under 5 group, I'll have the statistic. If I want to have like a statistic for only male or female, I can also have them based on the method, the approach that we proposed. So globally, this is how our methodological framework look like, where we use the Poisson model. We have like 3 components in our model. The first one, which is the distributed lag nonlinear model that consider the delay effects. We have like the second one that help us to include like the co-founders. When we have like a socioeconomic factors, we can include them in the model. And then we have other factor that consider the spatial temporal effects, random effect, and the seasonality. So when we have all those complete those model, the key element that we have at the end to consider is the relative risk, because the attributable number are calculated based on the relative risk. The attributable fraction are calculated based on the relative risk, and then the attributable rate also are calculated based on the relative risk. So all these elements are available, and then we can also have access to them online. So now we are coming to discuss a little bit of some funding that we have. So for the funding that we have here, based on the Ghana data, as a reminder, we obtained the malaria data from the Ghana Health Service. And then we also obtained the data. We used the GMET data and some reanalyzed data as well. And then the population data also that coming from the Ghana Statistical Services. All those data, we clean them and then we integrate them in one system, meaning that we have like the climate data, the health data, the population data, all in one sitting. And then we use that database to have the results. So one of the elements that we need to consider when we want to use the model that we propose is the lag definition, because we said that there is a delay effect. So we need to know at which level or which is the maximum lag, which is the maximum delay effect that we need to include in the model. And then we have a way of calculating it and identifying the maximum lag to be used. And then here we have the exposure lag function that are showing the relative risk. When we have a high relative risk, meaning that that one is the number of the delay lag, the number of lag that we need to include in the model. And here we can observe that we have like a high risk between like 2 and 3 months. So meaning that if we have like temperature event today, if we have rainfall event today, it might take at least 8 weeks before we will have like the diseases outbreak. Why this? Because, for example, if we take rainfall, if rainfall create a condition of mosquito breeding site, the larval will be there, and then the larval will need a certain period to develop. The period that the larva will take to develop added to the time that those mosquitoes will reach people, beating people, and the time that people will be sick. So all those elements are included so that we can have like the maximum lag. And then this helps us to really calculate the relative risk. So to calculate here, we clearly identify the relative risk within like with the temperature. So for example, for the Ghana cases at country level, we identified that within 28 degree to 32 degree, those are the area where we have like a high risk. The high risk, we have like a threshold. If we have like a relative risk equal to 1, meaning that we don't have like any effect. But if we have a relative risk higher than 1 or below 1, higher than 1, meaning that we have like a high risk, and then lower than 1, meaning that we have like something like a protective risk. That one is not like a harmful risk. So we clearly identify the range, and then based on the range that we identify, we are able to calculate later the relative risk, the attributable number, the attributable fraction for Ghana cases. So here we have the result for specifically the district level, because our purpose is to have like the risk, the statistic at lower level as possible. And then here we have at district level, we have at the region level, and then we have at country level. So for district level, we clearly identify the area with high risk. So here we can see where we have like a red color, those are the area where we have high risk. And then where we have like, we don't have like red color, those are area where we have like a protective risk. Meaning that, for example, in northern Ghana, are the area very sensitive to like climate malaria relationship. Something that we observe also is that over the year we observe a little decrease in terms of malaria risk, and this show up that yes, some policies are in place, and those policies are working to decrease the impact of extreme temperature on malaria cases. So remind us that the purpose of this work is to have those statistics. So here now we are going to have like to see those statistics that we come up when we are talking about attributable number. So the attributable number help us to have like the excess number, the excess cases among like the observed cases that are caused or that are attributable to the extreme temperature. And here we can observe that those numbers are increasing. And then in the bracket we have like we have like the fraction, the proportion of the observed cases. So here we have the statistic at country level, and we have also the statistic at the region level. At the region level, we clearly identify the regions with the high attributable number related to extreme temperature. This means that those areas should be targeted for policy, so that the cases might be decreasing. And among those areas, we have a specific area, for example, the Bono State, the Eastern, the Ashanti region. Those are the regions that come up with the highest attributable number over the period that we considered. Now, we can have also a yearly statistic, because the point is to have to know, to identify clearly that, for example, if we are in 2024, what are which area have like the highest statistic that can motivate like policy implementation and so on. And then here we have that statistic. And then, for example, in 2024, Ashanti region show up with the highest attributable number, while we have like the Great Accra with the lowest attributable number. But the good thing that we notice that, for example, in terms of the percentage of the observed cases, we have a relatively low percentage. But still, we have like the impact. We have that statistic that's showing that effectively extreme temperature are affecting malaria cases. We can also have another statistic that show, for example, region comparison, and then within year comparison to see the trend. For example, if I consider a specific location, how the cases or the attributable cases are like changing. So here the attributable number are increasing, while we have other regions where the attributable number are decreasing, meaning that we have some area that are shifting from non-malaria area to now malaria cases area. Those are the key elements that we need to identify so that policies implementation can be easily adapted. So for the attributable rates, when we now consider the population, because we know that each region doesn't have like the same population, so we include the population in to have like to easily compare and have like the incidence. So here, using the incidence, we identify also over the period that we are considering, the 2013 to 2024, that Borno State, Upper West, and Otiu come like those areas with the higher risk when we are considering the incidence, the attributable rates. So all those elements indicate clearly that extreme temperature are affecting malaria cases, and then those areas identified should be the targeted area for policy intervention. We also have this at annual basis, like we have for 2024, and then we identify clearly those statistics. So once you have your data and you input your data, you have the possibility to have all those statistics for reporting the extreme temperature impact on malaria cases. We also have some results basically for rainfall, but for rainfall, what we observe mainly is that rainfall is acting globally as protective factors, because like when we have a heavy rainfall, it contributes to flush away those breeding sites, and that is what we observe. But we need, like as we said, we need some little count of precipitation of rainfall to create the breeding site, meaning that we observe that when we have, for example, the rainfall, the cumulative rainfall less than a certain threshold, it is contributing to have like a high excess number due to extreme rainfall. And here is the district level mapping showing broadly a protective more than harmful impact on malaria from rainfall. So also for rainfall, we come up with those statistics as earlier, and then we clearly have those elements as I said. We have the attributable number, we have attributable rate, and then we have like the attributable, we have the within region comparison, within year comparison, so that we can inform regularly how those climate factors are affecting malaria cases. We have also the attributable rates, same for malaria cases. So as I said earlier, our objective is to have the indicators, not only the indicators, but having also a platform. So we come up with the platform, this platform that we are using for calculating the indicator. Once you go to this platform, you have a possibility to input your data, to download, for example, the result that you have. And this platform also contains the guidance on how to clean your data, how to prepare your data to input them in the platform. So we have like the introduction documentation, we have the methodology document, we have the metadata sheet that will help or guide users so that they will be able to use the platform to have like the annual report of how climate is affecting malaria in their specific area. So thank you very much for participating in this presentation. What I just have to summarize is that our research helped us to propose or identify a key indicators to be used for reporting annually how climate factors such as relative risk, climate factors such as extreme temperature, extreme rainfall are affecting malaria cases. And those indicators are generalizable and can be used in every setting. Once you have the monthly reported cases, you can use this method for having those statistics annually.